Welcome back to ID Rounds. Today we're discussing a paradigm shift in treating one of the most challenging fungal infections, disseminated coccidioidomycosis, or valley fever. Endemic to the southwestern US and parts of Latin America, coccidioides is a soil-borne fungus that infects an estimated 150,000 people every year. While most cases are mild, about 5% disseminate beyond the lungs, attacking the skin, bones, and even the meninges. For these patients, the road is often long and difficult. Standard antifungal therapy hasn't seen a new drug approval in nearly 40 years. These azole-based treatments suppress the fungus, but they don't cure the infection, often requiring decades of therapy. But 3 concurrent studies, led by researchers at Stanford, have identified a new culprit. It's not the fungus's resistance, but our own immune system's dysregulation. The research reveals 2 distinct dysfunctional forms of immune response in disseminated disease: T-cell exhaustion and Th2 skewing. In some patients, T-cells become exhausted from chronic antigen exposure. They simply lose their functional impairment, marked by high expression of the PD-1 inhibitory receptor. In others, the immune response skews toward a Th2 or allergic phenotype. These type 2 cytokines dominate the landscape but fail to actually clear the fungal threat. The results of correcting these failures have been dramatic. One patient previously confined to a wheelchair regained the ability to walk. Another went from breathless to running. By targeting the host response rather than just the pathogen, we can correct the underlying immune failure. This is a complete departure from 40 years of standard care. Clinical trials are now warranted for interferon gamma and dupilumab. We need to identify exactly which patients will benefit most from these additions. This is particularly relevant for high-risk populations, including Black and Filipino patients and those who are immunocompromised. Correcting immune failure represents a major step toward long-term viral and fungal control. This is the future of infectious disease pharmacotherapy. I'm Dr. Noni.